Doesn't it look like X-ray?
Yeah, we should start. Yeah.
Doesn't it look like X-ray affecting?
All right, so we'll get started, everybody. Good afternoon, and thank you for coming, everybody who's in the room and everybody who's online, to Dr. Appleyard's faculty discussion. We're hoping for a real discussion today, following our theme of developing evidence for CAM through research and scholarly activity. And Bob is actually going to talk about engaging in research and scholarly activity at national. So some of the procedures, some of the policies, some of the works that we have at national that will allow you to succeed in engaging in research and scholarly activity. So thank you for coming.
Okay, well, thank you for being here. And by way of introduction, when Barbara asked me about this many months ago, and I said, sure, that sounds great. That always sounds good when it's months off. I'm not here to pontificate, nor am I here as the expert, but along the lines of what we had discussed, I'm happy to share some of the experience that I've had over the years on this topic, engaging in research and scholarly activity, and it's here at National because that's where we're at. First time it just, I'm sorry, okay, there we go. As I was trying to get organized and get a little bit more focused on what I wanted to do, Barbara shared with me some of the results from a faculty survey, and these are some of the points that came up from the survey results that she had compiled from the faculty: how to propose a research project at National, what type of institutional support is there, how to plan time, and what resources do we have. So I'm using this as my overall outline that I've organized my remarks around. Now, in terms of the target audience, I was just thinking about, at least at my level, my understanding of how we're divided up as faculty in various departments, what I'll call the academic teaching faculty, all of us in the departments of basic sciences and clinical sciences. We have the clinicians working within the various clinics, and then as a separate category, I listed the research faculty all working in the Department of Research. And the target group that I was thinking of as I put this together were the first two, because research faculty are, by arrangement, the situation is just a little bit different. But of course, Geraldine, Greg, those of you who are here, and Jen, you're welcome to be here and
thank you.
But I'm thinking more in terms of what we'll call the teaching faculty, along with the clinicians, the non-research faculty here. This group that I was thinking about putting this together. Now, the title, it uses a phrase that is extremely common: research and scholarly activity, or sometimes you could flip them around: scholarly activity and research. We see these two words, research and scholarly activity. They're always tied together in a single phrase. But being the academic that I am, I actually want to look at each one of these phrases. And let's start out and let's establish a basis on a common ground on what we mean when we use these two words. Well, looking through some of the NUHS resources, or any mention, well, these words are mentioned in lots of documents, but in terms of trying to come up with an implied definition, in the National University Bluebook, and I know this document has been mentioned by Judy, and I think, Jen, you may have mentioned it in your earlier presentations in this series. This is kind of like the research document, kind of a policy procedure document from within the research department. And looking in the Blue Book under definitions, we have this definition, which I think is very nice, and just taking I don't need to read the whole thing to you, but for research, a systematic investigation and use of the scientific method to develop or contribute to generalizable knowledge. That's a nice, succinct, and definition. I certainly have no argument with that. I think that's a good one to work from. I'm keen in on the phrase systematic investigation, use of the scientific method, and then develop or contribute to knowledge that's generalizable. So that's a nice starting point when we use the word research. Now, scholarly activity, we find that phrase in documents and policies everywhere you look, but I couldn't come up with a nice, succinct definition for scholarly activity. Maybe that's just because I couldn't locate it, like we came up with for research, or like I came up with for research. Now, here are my own definitions, and I had actually written these down as I was making some notes thinking about this talk before I had then gone to look up where these definitions might be published in our university documents. So what I had come up with, research implies a defined project with a tangible outcome. Now, what do I mean by tangible outcome? I'm a traditionalist. My training is as a PhD, went through a pretty traditional graduate school, postdoctoral experience. And by tangible outcome, what I'm thinking about is either a presentation at a scientific scholarly meeting that typically would include a published abstract for that presentation and or a published manuscript in one of the peer-reviewed journals. So my use of the phrase tangible outcome, there could be other, we might be able to list other things to this as well, but this at least is what I had in mind, what I was thinking when I came up with this. A defined project with a tangible outcome. Now, this imposes certain requirements. If we're going to do a project that leads to an outcome like this, we have to have a pretty specific objective in mind when we embark upon that project. My background, my training is that the objective generally is going to be hypothesis-based, but that, again, we could generalize upon that a little bit if we wanted to. But an objective to be investigated, and my list was fairly similar to what was in the Blue Book, investigated via experimentation, clinical observation or trial, survey, or literature review and summary through application of the scientific method. So when we talk research, at least in the next couple of minutes as I'm discussing research, these are the definitions that I have in mind. Now, scholarly activity. Here's my definition. This does not require a tangible outcome in terms of a published abstract or manuscript. This is just my opinion coming up with a definition for this term. However, there's still a clearly articulated purpose and objective, but it could be more general in scope. And when I think of scholarly activity, this little 3-point bullet list is certainly fairly inclusive of what I think about. Staying abreast of the literature within my own or your own field of expertise, researching and summarizing current evidence in support of topics that we are assigned to teach here within the curriculum at the university. And should I want to embark upon a more specific research project, there's a lot of initial groundwork that has to be done first, and that groundwork, doing the background reading, the planning, that has to be done in preparation of just proposing some type of research project. I would certainly incorporate that effort under scholarly activity as well. But again, this is a little bit more general, keeping abreast in my field of expertise. That's not going to lead to me writing a paper necessarily or speaking in a meeting. Nevertheless, I think that's valid when it comes to this term scholarly activity. So I think this term scholarly activity is more encompassing. I guess I'd list research as one aspect of scholarly activity, but scholarly activity can be other things as well. And I at least differentiate between these two terms. They're always put together, research and scholarly activity, but I tend to differentiate between the two as having somewhat different goals, somewhat different objectives and outcomes. Well, one of the questions was, how do I get started? How do I go about proposing a research project? So I thought I'd offer a few comments just based upon my background and experience, kind of thinking within, always bringing it back to our reality here at National. Now, this is my own quote, because I think research is a pathway. There's a number of steps we have to follow if we're going to embark upon any type of successful research undertaking. And you can quote me on this, every step along the pathway is the hardest. Now, that again, that's just my opinion from my own personal experiences. Now, previously, over the previous months in this series, we've had Jen Dexheimer, we've had Judy Pochius speaking to us about the process of engaging in research here at National, proposing a project. We've learned a lot about the Institutional Reviewer Board for Human Subjects-Based Research and the process of getting material prepared for that level of review. But what I was thinking about, well, you know, that's good information, but there's actually a lot of work that has to be done just to get to that point of actually having something that is going to be brought up to the IRB as an initial step to actually get started. So that's where I was thinking. What leads up to that process where we've already heard about the kind of the administrative processes we have to go through here at National to actually get a project online and running? What goes on just to reach that point? Well, this again reflects perhaps my training going through a fairly traditional research-oriented PhD program in biomedical sciences. I actually was in veterinary science back in those days. You have to start with a good research question. I think all research, you know, I mean, if you look in the popular literature, we hear about research is hypothesis-driven. The scientist, the investigator has a hypothesis, and wants to go investigate that. And that's all good and true. But from a practical experience, and this is kind of my own experience of people who I've interacted with over the years, starting from my graduate school experience and then moving on from there. The people who I've seen, who I've viewed as successful biomedical researchers, they all had a question that got them started. And I think starting with a good research question is the very first step if you want to embark upon this pathway. Well, where does the question come from? Well, number two, needs and interests of the institution and profession. Certainly, within the profession, chiropractic, within naturopathic medicine, within acupuncture, there are current questions that are being talked about within the field, within the profession, as questions that are current, that maybe are worth investigation to try to advance the field, whether it's advance the practice of the field, establish broader legitimacy and buy-in to some of these fields in CAM from the greater public. And those, of course, are a good starting point. What are some of the broad questions within the particular fields that we may start with? National has talked about certain interests that could serve as a question from which one of us could start to develop an individual effort of doing research. I know we've talked about primary care. That's one of our focuses that we have for our graduates, and selecting certain topics within the field of primary care to try to develop additional knowledge from the perspective of our individual CAM practices. Dr. DeBono periodically talks to me about stuff he's been learning about and reading in mechanotransduction as possibly having a proposed mechanism by which manipulative therapies as well as acupuncture may even actually be having biologic effects within the body. And that's actually a pretty interesting topic, I think. Some of the papers he's shown me, I thought have been pretty interesting. So certainly there are interests of the profession. The institution that we work at may have certain preferences for what we spend our time on, and that's legitimate, even though this is the part of me that's the independent academic. says, number one, where does a research question arise from? Well, it arises from my background and interests, my experience, my expertise. And we can't deny that because research is very, very hard to do. And I don't believe in just top-down committee-driven research. A committee says, we need to research this topic, you on the faculty go research it. While there can be some direction and guidance, and we may have to move a little bit in that direction, this is just my own personal opinion, this is driven by individual motivation based upon our own background, our experiences, something we've experienced. I'm a basic scientist, something I encountered that I thought, this is interesting, I don't understand it, I want to understand it more, and I think it's applicable in the area that I'm teaching in, and maybe has some application in the profession that I'm helping to support through my teaching. Clinicians, you encounter problems and questions all the time in your patient work and the people that you see, and I think many personally driven questions arise from that. So I think a good research question is a combination of both certainly meeting some need for the profession, for the institution, but I'm a believer that it's driven by our own individual interests. Well, I've learned this, the research question has to be more than just interesting. Just because I stumbled across something and I thought that was interesting doesn't make it a really good and valid research question. Almost always, we do have to ask for various levels of institutional support if we want to do research. We're going to have to go through peer review in order to get our research approved and or published. And that means just because something is of interest to me doesn't necessarily mean it's going to be a good research question that I'm going to get any traction out of in terms of actually doing something. There has to be justification and relevance for the question based upon current evidence, current literature. I think that's an absolute requirement. That's one of the starting points that has to be done. Has the question already been asked and answered is also valid. Just because I don't understand something, maybe someone else has already completely researched it and figured it out, and if I just go and do the work, I'll discover it's already out there. It's been published, it's been answered, and it's not really that serious a question in the broader world anymore, even though perhaps it was to me because I just wasn't aware of it. Is the question testable and amenable to investigation, whether it's experimentation, theoretical analysis, survey, clinical observation, or some other form of outcomes analysis? At some point, we have to also address this particular point, and this is very important. I know some of us who were at the Phase 2 retreat. I just went to the first hour of it, and then I was able to leave because I wasn't required to be there. But when Dr. DeBono gave his introduction, he mentioned that little analogy from Carl Sagan talking about the fire-breathing dragon that's in his garage, only nobody else could detect that it's there because only Carl Sagan knew it was there. But the fire was not heat sensitive. It floated, so there was no footprint. It was incorporeal, so there was no body that you could see. So he was the only person who knew that it existed. Well, I think there was a point to that. I'm not sure what the point was, but I think there was a point to that. And that came to mind just as I was over the weekend going through these notes, that I think if you were there and heard that comment from Dr. DeBono, I think that's applicable to this point. A good question for scientific investigation has to be testable, or else it's not a good question, period. And then finally, just to be practical, we could meet all three of these criteria, but then we do have to ask, coming back to the experience here at National, or wherever we happen to be working in reality, will there be necessary and sufficient resources, infrastructure, personnel to address the question? All of us have probably stumbled across questions that we thought were of interest. Gee, maybe I'd like to pursue, but the reality is I'd need some huge mega-million-dollar facility in order to go about pursuing it. And while I look around campus here, that facility isn't here, so I can't really go very far with that question unless I was able to make connections with someone who had what was needed. So ultimately, a good research question for us does have, I think it starts with all the other points, it starts with our personal interest, but it ends up with this final point. We have to say, can I pursue it here at National, realistically, given the resources that are available or potentially can be made available for it? So I think all of these are just practical elements that go into that initial stage. Yeah.
I have a quick question. So sometimes a person working here might not be fully aware of what support might be available. So is that a question that's easily answered, or do you have to just say, well, I've never seen it, so it must not be here, type of a thing?
You know, this is just my opinion. I think the answer is somewhere in the middle. You know, I can get pretty aggressive, and if it's something I'm interested in, I'll start digging. I'll start bugging people. I'll go to Greg. I'll go to other people and say, hey, I'm interested in doing this. And here's what I need. Do you got it? Can I use it?
Okay. You just have to knock on some doors.
Yes.
Send some emails.
Yeah, I think so. I mean, that's my experience, and it's worked. And so I think that is what we have to do. On the research now, this was under the scholarly activity. I was just doing some reading last week, and this is just related to, I'm in my cardiovascular section now in the physiology course I do. And I was looking at a review article last week, and it was written by this guy. It was the title, you know, it was a reference to the article that attracted me to it, and got the article on Thursday, I think. And it was fairly typical. This was a guy who's an established researcher in the hypertensive field. He was invited to do one of the invited plenary addresses at one of the big national meetings on hypertension. And then the manuscript, he wrote a manuscript that was published in the journal Hypertension, American Heart Association journal, that summarized the talk that he gave. And typically those are a senior investigator, senior physician or scientist kind of putting together their experience over, in this guy, I think it was several decades of work that led up to this point in time. And right in the introduction, he was talking about, as he was a postdoc at the University of Iowa Medical School, interested in the field of hypertension. This had to be back in the 1970s, because this new circulatory model, Arthur Guyton and Associates had just published this big, complex circulatory model. You know, that was the buzz back then. Everybody was talking about it. And he stated, this was the question that he formulated as a beginning researcher. Can the sympathetic nervous system participate in long-term arterial pressure regulation within the framework of the Guyton-Coleman circulatory model? Well, he's had several decades of a very successful career stemming from this question. I think, so I just share this as having just run across this. I think this is a good example when I'm talking about formulate a good question upon which you would base your research. This is both overarching and specific at the same time. It's overarching in that certainly a question such as this cannot be answered with a single experiment, a single research project. Yet it's pretty specific. The involvement of the sympathetic nervous system for long-term regulation of arterial blood pressure, that's fairly specific within the context of a particular model, which is pretty much the standard model that most people employ nowadays to analyze the cardiovascular system. But I thought that was just a good example to share of what is a good, well-formed research question to serve as a starting point. Now, right at the bottom, that's one that I happened to come up with. It was probably about 10 years ago when I first did this. Can heart rate variability analysis be utilized to measure a change in autonomic sympathetic-parasympathetic balance in response to chiropractic manipulation of a dysfunctional spinal segment? I've always had to get consultation on how to phrase that. I think, Dr. Johnson, did I say that okay? But 10 years ago, that was okay.
Well.
Yeah, what I know. The wording keeps changing, but that was kind of how I was coached. That was kind of how I was coached to.
The thing is, some people are questioning the word dysfunction these days, but that's the term that we came up with as the functional spinal unit. So if it's a dysfunctional spinal unit, I think that's...
Yeah, I mean, this
The semantics aside, it's a great question.
Yeah, this is 10 years old, and I know we settled upon spinal dysfunction as a phrase to use for this. I've gotten a little bit of mileage out of this. This, again, is something that's given rise to several very small projects that I've done in the ensuing time, and it's still, the question's still there. You know, I tend to think about it quite often. I'm still reading a lot of stuff about it, and I've kind of gone various pathways based upon the experience I've had with this as a starting point. Well, that's just the starting point. Start with something of interest to you that fits into these criteria as suggested criteria as your very first step. Well, where do you go from that? In terms of research, an individual project will then come out of the research question that you first formulated. Now, again, a research project should lead to a tangible outcome. You're going to pose a particular little issue within the broader context of your question. You're then going to investigate that issue with plans that you will summarize and report on what you found, whether it's a meeting abstract, published manuscript, or other forms that may be coming available for us to report these types of results. An individual research project is just one little bit of the broader question that we have. It may take us a long way. It may be just a very small step that it takes us, but that's the difference between starting with an overarching question, and then from that we start to say, okay, where am I going to go with this? What am I going to do? Let me come up with a project that lets me start to work towards this question. Well, so that's the next step. We got to flesh out some kind of a specific project. This again this is the way I've been trained, so this is the world that I've always existed in. Well, my requirement now is I'm going to have to propose what it is I plan to do. Now, I'm sure, you know, we've addressed in this series, we've addressed some aspects of a research proposal. You know, we could certainly spend a session like this dissecting what a good research proposal is, tips on how to put one together, and that's not what I would want to try to do right now. But two broad points that I work with if I'm going to put together a proposal, and I've done a few, it has to have a statement of a specific purpose and objective, and that statement of purpose and objective has to be supported with the appropriate background information coming from the literature, and put it into the context of the larger picture, which is my research question that I'm starting with. Then a proposal has to be specific as to the intended methods, sufficient detail to demonstrate that I can achieve what I'm proposing to do. And I think that, to me at least, this is really the meat of any research proposal, to address these 2 points. And depending upon who the proposal is being prepared for, there may be other things that have to be addressed and added in, but this is the core of it. You're all staring at me, so you could disagree with me.
I might add the word specific aims. You know, the specific aims are so frequently discussed that it might be just worth mentioning in this right here.
That's true. That's true, and the NIH, fortunately, unfortunately, depending upon my point of view, I haven't had to do an NIH proposal recently, which is a lot of work. But yeah, that's right. And they have aims and objectives, don't they?
They start with an objective, then you break it down
and then
to
specific aims.
And they do everything. Everything is judging the aims. That becomes the whether you sink or swim. That's based on how you do that.
So underneath the
semantics, is an aim and an objective about the same thing, or no?
No, they're different. And Greg's the expert.
So an objective is like the purpose is you know, we want to assess heart rate variability in, or you can do it a few ways. Let's say we're going to study heart rate variability in this population of patients to look at this outcome, specific aims, and you can tie this in with hypotheses. Heart rate variability will change in those manipulated. Heart rate variability will change in those that receive hypnosis or something.
So it's aims similar to outcomes?
Yes.
Like,
there. You have a goal,
expected
and aims at expected outcomes of your...
Yeah.
Yeah, I think that's not a bad way. That's a good way to look at it. If you equate aims to specific aim to outcome. Yeah. For me, this is one of the hardest parts to articulate this, put it together, and most often, if we want to do a research project here at National, certainly if it involves human subjects, or even, I think, if it would involve, let's say, going through charts or medical records, you're not actually going to interact with patients, but if you are going to be using data from the clinical charts, from the clinical records, the project has to be reviewed and approved through the IRB. Judy's gone through, and Jen have both gone through aspects of that. Prior to submitting to the IRB, at least, and I'm just a little bit outside of being current as of right now, but the process has been, first the proposal goes to the research committee, headed through Greg, and the research committee reviews the proposal first for content, objectives, aims, methods, and has to approve the project as being valid from those perspectives, achievable from those perspectives before it goes to the IRB that then reviews it for the human subject protection from the perspective of whatever the current policies are now for human subjects.
So in reality, and I'm sorry to interject, but just so the way it works, Judy will assign it to a research committee member that rotates, and that member does what Bob just said for the committee and makes a recommendation on behalf of the committee.
Mm-hmm. And this can be painful. I've certainly grumbled about it when I get something put together and I think it's wonderful, and then I send it in and it comes back to me with comments that say, well, it's less than wonderful, and here's some things we need you to address and would like you to consider and think about. But this is absolutely necessary. We're talking at the professional level, and this is real life. That peer review means whatever we put together, we have to accept and we should embrace that we're going to send it to our peers. We may feel like they're going to pick it apart and rip it apart and miss all the wonderful things that we see in it and just nitpick it for everything else and send it back. And it becomes an iterative process, and it's frustrating. I'm all excited and ready to go, and then it comes back and says, well, we want you to address these points, and now I'm going to have to delay another month or two while I rewrite this stuff and grumble, and then send it back, and then the committee's going to review it again, and then you're going to get the feedback. But this is absolutely necessary because this is helping me get to the point that I'm going to have a project that's actually going to work and produce the type of results that I'd like it to produce. So if you've never gone through this step, this is hard. It's real hard to get everything put together, get to the point where you think, I have this ready to start to share with other people. I'd recommend that you just shop it around to individuals, and I think that's very typical for us who have had approved research before we get to that point. I mean, we'll just share it with other people that we know and say, hey, I put this together, would you read it for me, give me the critique and comment, and get some little things that I missed perhaps cleared up before I finally send it in, whatever level it's going to be for formal review, and then just understand, well, it's going to come back from formal review, they're going to pick some things apart, And yes, while that's frustrating in the end, that's to help us all to make sure we're going to have a really good, successful project in the end. And this can take time. It can take months and months and months, depending upon where we're at, how much development work needs to go into it. But I think this is vital, and it's something not for us to fight, but we should embrace it, because in the end, this is what peer review is all about.
Yeah, Bob, what you described is very similar to what happens when you're submitting a article to a journal. You have a peer review process in which reviewers are looking at articles, and typically, if you're an author, you don't get it accepted the first time around.
Mm-hmm.
It gets sent back to you with reviewer comments, and you have to satisfy those reviewer comments, and you send it again. And then you could get it sent back again after that. So, but it does make it a better article in the end, and that's the point that you're making, that your submission as far as your research project will be better when it's under scrutiny like that.
It is. I'm a big supporter of peer review, and while it's a lot of work and it can be frustrating, I don't know that there is a better way of doing it. I know it gets talked about in the big world, but I have coming up through that world, I think it's very effective. And people do have to buy into it for it to work. And just within our institution, we have 1 or 2 layers of peer review, that research committee, IRB, that we have to go through before we could even get started. And there's a point and a purpose for that. Well, that's all good. So if this sounds of interest, you say, okay, fine. How am I going to do it, and when am I going to do it? Well, of the survey results that Barbara had sent back to me, there were these 2 quotes, kind of under the heading, what type of institutional support is there? One is, it seems like we have to do this all on our own extra time. Well, my parenthetical comment is, yes. I really don't have another response to that. Yes, I do have to do this all on my own time. It's something that I've chosen to undertake, and it means now I've got to put the time into it. It's, I have a lot of friends in the non-academic world, and they still always give me a hard time of have no connection with the real working world. I'm an academic, and the outsider's perception that whatever their perception is, but it's like, gee, you don't have to work hard and whatever else. People who I know who do biomedical research, their work week is typical, 60 to 80 hours a week for a typical biomedical researcher in a medical school, between their university duties and then the work they're doing on their research. It just sucks up huge amount of time. I'm not as willing to stay up all night and early in the morning every time to do it as I did 20 years ago, but still, I'm going to be putting in a lot of evenings, reading, writing, working with data, whatever it may be, get up early in the morning and do it, whatever it is. I've got to find time outside of my regular work day to get this done. That's just part of the reality, but I'm doing it because it's interesting, and I kind of want to do it. But yes, we do have to do this, and we have to make extra time to do it. I don't think there's another way around that. The university does not really give us credit for such activity. Well, I kind of want to steer around that one. I wrote maybe, maybe not. That's really a matter of perspective. I feel like I have received support and recognition from the university. I've certainly expressed a little bit of frustration. I wish it would be more so than I've received. But I can't say that, gee, the university doesn't support me at all when I've spent time working on a project. Even though it's not apparent, going back, Christine, to what you said, it's not apparent, it's not just given to us. I have to be a little bit aggressive on my own part. I have to kind of step forward and say, hey, this is what I want to do, and I need this support. And I'm not the acknowledgement part isn't as important to me as long as I'm not being downgraded, because I'm doing that, let's say, in lieu of something else, but I do it because it's out of my own motivation and interest. But I still need to receive some acknowledgement, at least to the extent that maybe it's going to take away a little bit of time and energy from me for other duties. Is there an expectation that we even do any of this? I always think that's an interesting question, isn't it? Our full-time faculty load and the contractual obligations that I think most of us have requires that the majority of our time be devoted to teaching and university service. That's just an assumption on my part, but I feel confident moving forward to that. At least within my own contract, there's this one little line among all the other bullet points that says, in addition to instruction, engage in other scholarly activity. I assume that's probably boilerplate. I don't know that as a fact, but that's just an assumption that that's probably the boilerplate that's included in the typical faculty contract here. So you say, well, okay, it says I'm supposed to engage in other scholarly activity. All right, fine. Where do we go with that? Well, I have become familiar with the CCE standards for accreditation because I'm currently in the Academy of Site Team Visitors with the CCE, so I've been going through some of the training with them over the accreditation standards, and this is actually the area that they have me focus upon. I've been on a couple of site visits now. And two of the standards, Standard E, under the faculty includes the statement, demonstrate currency in their discipline, ongoing development of expertise and use of resources, mainly applied towards teaching and instruction. And then under a different section within the accreditation standards, research and scholarship, the DCP academic community bears the primary responsibility for advancing the profession which its students will enter. I like that phrase. I think that's a pretty good phrase myself. And that certainly has some implications if you read that phrase and take it at all seriously. And then, in addition, research and scholarship should inform the instructional objectives and content of the DCP with respect to methodology values and to guide clinicians in the care of their patients. Now, the second standard, research and scholarship, is applied to the program as a whole, but it addresses the academic community. That's us, the faculty. So looking at the accreditation standards for chiropractic, I'm not real familiar with the naturopathic standards, but I'm sure they have something similar to these. The AON standards I'm not familiar with, so I'm not certain to what extent they would address something like this. But certainly in chiropractic, under our accreditation standard, there is some expectation for faculty to be engaged in scholarly activity and for the institution to be supporting research. And if the institution is supporting research, who's going to be doing it? Well, the faculty within that institution, I would presume. Could you advance me one? Thank you. And then under the standards or characteristics of evidence, this is still within the CCE standards, they list these 4 areas, and this is what they're actually looking for. Discovery, application, integration, and teaching. Now, what number 1 and 4, discovery and teaching, I think those are, I read those as being a little bit more, that's the research. That's doing a project towards a more tangible outcome, whether it's basic discovery or whether it's research on teaching methodology, curriculum, methods of assessment. But 2 and 3, application and integration, that falls under my definition of scholarly activity that I think more of us should be involved in. And I think these statements are very, very succinct, but I think they provide some guidance on, well, what should we be doing individually as faculty, certainly within this area of scholarly activity. So how do we do it? Well, here's how I've done it. To a certain extent, because like everybody here, we have a pretty heavy teaching load, which takes up a lot of our time. I've merged a certain amount of my scholarly activity with my teaching so that the time that I'm spending, I'm satisfying both means at the same time. I've come up with various projects that I could say, this is my little tiny research project. Several have resulted. I've gone to meetings and done a poster presentation or a platform presentation on what describing what I was doing over the years. And at the same time, I was producing material that I brought right into the classroom and used with my teaching. So my solution for scholarly activity has been to use that to satisfy my contractual obligations to do the instruction that I'm assigned to do, the credits that I'm assigned to have to carry in terms of the time I spend within the classroom. Now, I'm not the example for doing this well, but the little bullet point guidelines, schedule regular time just for reading and review is very important. If I don't schedule the time, I'll never get it done. And currently, I'm kind of like everybody, got the iPad, so now I put all my documents on the iPad, and I can annotate them, and that's wonderful. And then I go home and sit down at home where I'm comfortable for an hour and read a paper. I'll make some notes on it. And I have to do that intentionally, or else it simply won't get done. What I'm even worse at is documenting that I'm doing this. So on faculty, when it's time for evaluation to document, well, I was doing this, and I brought it into the classroom, and here's how I brought it into the classroom. I'm terrible. I am not the example of how to do that well, but I recognize that's important. Barbara's kind of looking at me saying, yeah, we need that as part of our EVP evidence of what we're accomplishing here at the institution, and I agree with that completely. I'm just not good at it. I know that I'm doing it, and I'm satisfied that I'm doing it, but documenting it to share with my higher-ups in the administration or whoever, I'm not real good at. So the questionnaires Jen puts together and sends out in the research project is actually good, that I could document through some of those tools that the institution provides. And then identify needs for new instruction. I think that's valid for us to say, I run across something, I think the students here could benefit from it. It could support what we're doing inside of the curriculum, but it's going to take some effort to bring this new material together and develop it to put into the classroom. I think that's a very valid direction that we could take as individuals to satisfy this requirement for scholarly activity. And how do you do that? Well, follow some of the previous guidelines, plan it, state what the objective is, state what the purpose is, make up a little tiny proposal, bring it to the department chair, work it through the administration, get acknowledgement if we need approval for it, get approval for it, and then carve out some of our personal time to pursue it. But that time is supporting what we're doing as an instructor, as a faculty member. So that, again, tie those two activities together so I'm not constantly at war with, gee, I got to get all this material ready to teach, and I really want to be off doing my research, and that's frustrating. So my solution was to kind of bring these together so I don't have quite as much frustration with that. And I think, this is just a kind of a laundry list. Well, what can we expect for assistance? This is where I think we as a faculty have to be pretty specific about what our interests and needs are, and then we have to ask for it. If we don't ask for it, chances are we will not get it. And I think that's just life in an institution. That's life in a bureaucracy. Attendance at professional meetings, I think that's very important. To hear what's going on in the field, to interact with other people, to get some fresh ideas and views. I ask every couple of years, I say, I want to attend this meeting. And, I want to get a little bit of support. I don't want to fork out $1,500 on my own to pay for the airfare and the hotel. But here's the meeting I want to go to. Here's what I'm going to get out of it. And I want to go for it. And I've been successful. I've gotten support, but I had to go ask for it. Someone didn't come to me and say, hey, we want you to go do this. I'm not good at getting student assistance. I've been fortunate. I've had students come to me, say they were interested in what they heard I talk about, and I've had several students just volunteer their time and work with me. And I've taken advantage of that. I believe in paying students if they're doing work for us, if we're able to. I'm always told that we do have work-study funds. Federal work-study funds are fairly available, so if we could get a student that's eligible for work-study funds and just go through a department and try to at least get a couple hours a week from a student, paying them the standard $8.25 or whatever it may be hourly rate through federal work-study. And I think that's a viable means to help get student assistance. If we need space and facilities, I've done this. I went to Greg, said I want to do this heart rate thing. I need a room. We started out with a room here in the clinic building. Then that room got reassigned. I went looking around campus. A couple of faculty offices were empty. I went to the dean at that period of time and said, hey, I want to use one of these empty offices. I need to set up my equipment, and got approval for that. So again, I took the initiative. That this is what I need, went out and bugged people about it, making suggestions, not just saying give this to me, but making suggestions. Hey, I found this space, could I use it, or could I share it with somebody else? Equipment, for my heart rate variability, I use the same equipment that we have in our physiology teaching lab. It's pretty good quality, so I have to record electrocardiograms. I do some recording of the breathing motion with a strap around the chest. The equipment that we purchased for teaching is quite suitable to give me the signals that I needed for that analysis, those projects that I've done. So I took advantage of equipment that was here on campus, that was here for instruction. I was able to adapt it and use it for what I wanted to do. Dr. Tongali keeps saying to me, we do have a sabbatical program in the policy book. Someone needs to apply for it or it's going to go away. And it's really hard, for any one of us to let go of our teaching assignments. We're so tied up into it. But if we get to the point that we've developed a project that looks like it may really take some life and we just need some time for it, we do have in our national policies an avenue, there's no guarantees, but there is a policy that we could apply for sabbatical, at least a trimester of partial or full release time, so that we could pursue something else. And that hasn't been utilized much, if at all, to date. But it's something that...
Bob Shield.
Yeah, Bob Shield.
That's the only person I know.
Yeah, he's the only one I can think of right offhand.
Ezra Cohen did.
Ezra did too? Okay. So it's 1 o'clock, so I'll wrap it up there. That was just kind of a real quick survey talking a little bit of trying to address some practical things within the context of us here. Scholarly work, I think all of us should be engaged in that, is my personal opinion. I think we all can be. Research takes more investment, but it's certainly rewarding. But it's hard work.
Thank you. Anybody who's still logged in as a board or elsewhere have any comments, you can unmute your microphone and we'll still be here for a few minutes and you can ask your questions. Thank you, everybody, for coming.
Thank you.
And we'll have a follow-up on this, I think.
That was outstanding. Wow.
Very good.
Thank you.
Really good. The way you
Thank you.
broke it down. I love the way you approached the research question and spent time on that issue too, which is kind of overlooked sometimes as an important step.
Yeah.